Allison. My name is Laura. I'm going to be your nurse today. I'm going to be conducting a comprehensive physical assessment, evaluating your abdomen, musculoskeletal system, checking your strength, reflexes, and movements, as well as a full neurological exam. Please let me know if you feel any discomfort at any time. Do I have your full consent?
Yes.
Wonderful. So I'm observing your general appearance, and you look relaxed, calm, and your skin color is skin type 4, no signs of pallor or anything unhealthy. You're alert and oriented. Can you tell me your name and today's date?
Allison Cerrito, October 18th, 2024.
Wonderful. Okay, Allison, I am going to assess your abdomen, if you wouldn't mind laying down for me, and I'm going to roll up your shirt, if that's okay.
Yeah.
I'm looking for any scars, lesions, rashes on the skin, and your abdomen appears flat. It's not rounded or distended, and I don't see any visible swelling or bulging. I'm checking for peristalsis or abnormal pulsations. Let me just roll this down a little bit. Auscultation, so now I'm going to be listening to your bowel sounds. We're going to listen in all 4 quadrants for 5 to 30 seconds.
You okay? Yeah, I'm just crazy.
Wonderful. Now I'm going to listen for your vascular sounds to rule out bruits. And the goal is we don't want to hear any swishing or blowing. I'm going to percuss your abdomen. So I'm going to do some light tapping. Is this okay?
Mm-hmm. I did recommend it. Yeah, it smelled nice.
And now I'm going to percuss for the size of your liver. So as soon as I hear a dullness, I would mark your skin. So the markings should reflect anything from 6 to 12 centimeters. Okay, now I'm going to percuss your spleen between the 9th and 11th intercostal space. Take a deep breath. Wonderful. I'm going to lightly palpate your abdomen. Do you need to empty your bladder?
No.
Okay, wonderful. Do you feel okay with that?
Yeah.
Any pain?
No.
Wonderful. I'm going to go a little deeper, about 1 centimeter for a deeper palpation. And this is just to rule out any underlying issues. And so now I'm going to palpate for your liver. You comfortable?
Yeah.
Okay. Good. Wonderful. We check to see that anything is enlarged. Everything seems normal at this time. I felt for your liver, and again, liver and spleen, nothing was enlarged. I'm going to palpate your kidneys. You might be able to feel the edge of the right. You would never feel the left kidney. Now I'm going to do a musculoskeletal exam. So if you want to sit up for me. Wonderful. Okay, I'm just going to inspect your clavicle and your shoulders. Everything's symmetrical. There's no deformities. I'm going to palpate all your joints. I'm going to have you lift up, move around. Anything, pain, tenderness? Have you had any swelling?
No.
Okay, wonderful, good. I'm going to just have you bend your elbow. And then your wrist, everything feels okay?
Yeah.
Wonderful. You can relax, and I'm just going to have you move your ears, ear to shoulder. Good. And look right and left. Wonderful. And up and down. Great. Let's just check if you could range of motion, go all the way up, come down, around, come in front, and then come behind. Wonderful. Shrug your shoulders up, down. I'm going to test your strength. Come up. Good. Down. Wonderful. Put your arms forward. Push up. Good. Push down. Good. Come out. Good. And push. Wonderful. Strength is good. It's 5. Now I'm going to check your reflexes. With the inside. Good. Mm-hmm. And your radial. Okay. Good. And I'm going to check your pulses. The that everything is equal bilateral.
It's like you just can't take it off for a few hours.
Good. I'm going to inspect your hands. We would check capillary refill. She has nails on, so we can't see that, but typically we'd hold the nail bed down and make sure that it comes back within 3 seconds. I'm going to check your skin trigger and just make sure your wrists feel okay and sound okay. And if you want, just push against me here. Good. Pull. Good. Everything's good. Strength is a 5. I'm going to be inspecting your hips, knees, and ankles for swelling, redness, and abnormalities. And we want to always definitely check the feet, rule out gout, especially for your diabetic patients. Your toenails are healthy. We're going to do a Babinski check, so I'm just going to run up your foot, and we want to make sure that your toes curl. And I'm going to check this side. Woo, good. Wonderful. I'm going to check your pulses bilaterally. Femoral, popliteal, posterior tibial, dorsalis pedis. Wonderful. Everything's perfect strength, 5. I'm going to check your range of motion, so we'll have you just move your legs up and down, out. Wonderful. Your hips, everything feels okay. Can you point your foot, flex your feet? Flex. Good. Point, flex. And then I'm going to check your strength. So push up. Good. And push. Good. And push on my hand. Good. Push. Wonderful. Okay, I'm going to check your reflexes. So lean forward a little bit, scoot up a little. That's perfect. And I'm just going to do a little tapping here. Good. And tapping here. Good. And I'm going to do in your back of your ankle here. Good. Wonderful. Okay. So I'm going to check your spine. I'm going to check your posture, observing your posture for any abnormal curves or tenderness. Can you stand up for me? Perfect. So I just want to close your eyes and put your arms forward, right in front of you. Good. This is we're checking for drift, and there's no signs of drift. Okay, drop your arms and bend forward, lean forward. I'm just going to check your spine. Perfect. And now we're going to check all your cranial nerves. One more time, tell me your name, today's date, and where you are.
Allison Cerrito, Myeloplastic Surgery, October 18th, 2024.
Wonderful. So we're going to have you check your olfactory nerve, and that's 1, and smell. Is that some? Oh, wonderful. Olfactory nerve 2 is your vision. We already did, you can open your eyes. We already did the Snellen chart last time, but this is when we would hold the chart and we would test your vision for far and near. We would hold it 20 feet away, whatever line you could read, that would be your vision. Okay, cranial nerve 3, 4, and 6 is your trochlear and abducens, and that's your eye movement. So I'm going to check your pupil function. If you could follow my finger. Good. We already did this last time. Accommodation is good. I'm going to check your pupils. Wonderful. Perfect. Perfect Perla. Pupils equal, round, and reactive to light. Accommodation is when we came to the center of your nose and you followed my fingers. Next we're going to check cranial nerve 5, which is your facial sensation, your jaw strength. Clench your jaw. Perfect. And do you feel me touching bilateral?
Yep.
Good.
Yep.
Wonderful. So cranial nerve 7 is I'm going to have you smile and raise your eyebrows and puff out your cheeks. So give it a good big smile, raise your eyebrows up, and puff out your cheeks. Good. Checking for facial symmetry during these movements to assess the facial nerve. Cranial nerve 8 is your hearing and balance. So I'm going to do a small version of what we did last time, the Weber and Renee test. I'm going to strike the tuning fork. Do you hear the sound bilaterally?
Yes.
Perfect. I'm going to strike it again. Do you hear the sound?
Yes.
Wonderful. Which sound do you hear louder?
That one.
Perfect. So that would be checking those with the tuning fork. You would keep it on there until the sound dies. Same thing on the back of the bone. You want to make sure air conduction is louder than bone conduction. Cranial nerve 9 would be swallowing, and cranial nerve 10 is palate and voice. So let me get a tongue depressor. When I say ah, stick out your tongue. And so I'm going to check the strength. I'm going to look around. Stick your tongue back in. Move your tongue from side to side. Good. And your gag reflex. Okay, wonderful. So next we're gonna do cranial nerve 11, and that is your neck and your shoulders. So pull your shoulders up. Perfect. Oh, very strong. Okay. Cranial nerve 12 is your tongue movement. So stick out your tongue and we're going to check its movement and symmetry. Okay, good. Now we're going to do some coordination tests. So this is where you're going to place your palm, and I want you to come up and down and up and down. Perfect. That is the seated rapid alternating movements. And the purpose of that is to evaluate cerebral function for coordination and rhythm. Heel to shin, so take your heel and just brush it along your shin for me a couple times on each side. Perfect. That tests cerebral function, coordination of your lower limbs. Superficial pain and temperature, and just tell me where I'm touching you.
Back of my arm and front of my arm.
And what do you feel?
Cold.
Perfect.
Lower arm, cold.
Great.
Lower leg, cold.
Perfect.
Lower leg, cold.
Perfect. So now we're going to do a position sense, and I'm going to have you close your eyes and just tell me, hold out your hand, if I'm pulling your fingers up or down.
Up. Up. Down. Up. Down.
Perfect. I'm going to do this side.
Up. Up. Down.
I'm going to repeat with your toes.
Down. Up. Down. Down.
Perfect. I'm going to get a cotton tip and just tell me which way I'm going.
Up.
Wonderful.
Down.
Perfect. And now I'm going to put a familiar object in your hand, and just let me know what you think this is.
A key.
Perfect. Next test is graphesthesia, and I'm going to draw on your hand and tell me with your eyes closed what you think this is.
An 8.
Perfect. And on the other hand?
The letter A.
Perfect. 2-point discrimination. I'm going to touch you with 2. You're going to tell me if it's 2 or 1.
1. 2.
Perfect.
1. 2.
Great. Next, we're going to assess your standing and your gait, which is your walking. So if you could stand up for me. Perfect. And now, if you could back up and please do heel to toe. Wonderful. And walk only on your heels. Perfect. And on your toes. This tests your plantar flexor strength and the integrity of your spinal 1. We did heel to toe, which tests your balance and coordination. The last is your Romberg sign. You're going to close your eyes again. And here we would check to see if the patient is swaying. And there's no signs of swaying. If she did sway, it would be a positive Romberg sign. That's it.